Are you pregnant and struggling with constant back pain that makes it hard to sleep, sit, or even enjoy your day? You're not alone. Millions of women experience the exact same thing during pregnancy. But here's the good news. Relief is possible, and you don't need expensive equipment or endless appointments to find it. In this video, I'm going to show you simple, safe, and highly effective back pain relief exercises for pregnant women that you can do right at home. And I'll even reveal a powerful trick using nothing more than a tennis ball back massage method, so easy and surprisingly effective that it may become your favorite go-to solution. Stay with me until the end, because once you discover how these techniques work, you'll never look at back pain during pregnancy the same way again. But before the video starts, write in the comments, from where you are watching this video, thank you. Pregnancy is often described as one of the most transformative and beautiful journeys a woman can experience. A time when the body changes in miraculous ways to nurture new life. Yet despite all the wonder and anticipation that surrounds this period, it is also a time that places tremendous physical demands on the body. And among the most common challenges faced by expectant mothers is the persistent and sometimes debilitating discomfort of back pain. This pain, often localized in the lower back but sometimes spreading across the spine, hips, and even radiating into the legs, is not only a result of the extra weight that must be carried as the baby grows, but also of the hormonal changes, postural adjustments, and shifts in the center of gravity that inevitably come with pregnancy. For many women, finding ways to alleviate this discomfort becomes a priority, because living with constant pain can overshadow the joy of the journey, disrupt sleep, limit mobility, and create unnecessary stress. Fortunately, there are numerous strategies and techniques available, including gentle stretches, mindful movement practices, and even creative tools like a simple tennis ball, which can all provide meaningful relief and empower women to feel more in control of their bodies during this extraordinary stage of life. When we begin to explore back pain relief exercises for pregnant women, the most important principle to remember is that safety and gentleness must come first. Because unlike a typical fitness routine where one might push through discomfort or strain, pregnancy requires a different approach, one that prioritizes protecting both the mother and the growing baby, which means that movements must be slow, controlled, and mindful. Gentle stretching can be incredibly helpful because as the uterus expands and the abdominal muscles stretch, the lower back takes on more of the load, creating tightness and pressure, so movements that open the hips release tension in the spine and encourage circulation can do wonders for reducing pain and restoring a sense of ease in the body. Exercises like pelvic tilts, cat-cow stretches performed on hands and knees, gentle seated forward folds with legs apart, or side stretches that lengthen the torso can all help. And beyond the physical benefits, these movements often bring emotional relief as well. Because when the body relaxes, the mind can too, allowing space for calm and connection. However, one of the most surprisingly effective methods for relieving back pain during pregnancy does not even require elaborate exercises or equipment. It involves something as simple and accessible as a tennis ball back massage self-release. This technique, which has become increasingly popular among physical therapists, doulas, and yoga instructors, is based on the idea of applying gentle pressure to specific trigger points in the muscles, areas where tension builds up due to overuse or strain, and by rolling a tennis ball against these points, the muscles can gradually release, improving blood flow, reducing stiffness, and creating an immediate sense of relief. For pregnant women, this method is especially appealing because it can be done almost anywhere, requires no expensive tools, and can be easily adjusted to each individual's comfort level. For example, a woman might place a tennis ball between her back and a wall, then slowly roll up and down, shifting side to side to find the tender spots that need attention, allowing her to control the amount of pressure and focus on areas that feel tight. The simplicity of the practice is what makes it powerful, because in just a few minutes, significant relief can be felt without needing professional massage appointments or complicated routines. It is worth reflecting on why these kinds of self-care practices are so meaningful during pregnancy. When a woman chooses to engage in gentle back pain relief exercises or practices, a tennis ball back massage, she is not only addressing the immediate problem of physical discomfort, but also cultivating a deeper connection to her body, listening to its signals and responding with care and compassion. This act of tuning in rather than ignoring or suppressing the pain creates a mindset of awareness and empowerment, qualities that are incredibly valuable not only during pregnancy, but also in preparation for childbirth and beyond. For many women, the experience of pregnancy brings with it feelings of vulnerability, because the body is constantly changing and sometimes feels unfamiliar. But exercises and self-release techniques offer a way to regain a sense of agency, to remind themselves that they are capable of supporting their bodies through this process. Another aspect that makes back pain relief exercises during pregnancy so important is their potential to prevent complications or worsening discomfort later on. Pain that begins as mild tension in the second trimester can, if ignored, become severe by the third trimester, limiting movement and making daily activities like walking, bending, or even sitting uncomfortable. Simple routines practiced regularly, such as stretching before bedtime, doing pelvic tilts while lying on the floor or standing against a wall, or using a tennis ball to massage the back after a long day, can help keep the muscles flexible, the joints supported, and the spine aligned. Additionally, exercises that strengthen the core and pelvic floor gently under the guidance of a healthcare provider can contribute to overall stability, which not only alleviates back pain but also prepares the body for the demands of labor and recovery. Of course, it must be acknowledged that not all back pain during pregnancy can be solved with exercises because sometimes the pain may be related to underlying conditions like sciatica, sacroiliac joint dysfunction, or other issues that require medical attention. This is why it is always essential for women to consult with their healthcare provider before beginning any new routine, even if it seems simple or harmless, because every pregnancy is unique, and what works for one woman may not be safe or effective for another. Yet within the guidance of a doctor or midwife, most women will find that incorporating gentle exercises and self-release techniques into their daily lives can make a significant difference, and when combined with other supportive measures like using pillows for proper sleeping posture, wearing supportive shoes, or practicing mindfulness to manage stress, back pain can become far more manageable. Imagine, for instance, a woman in her 7th month of pregnancy who spends long hours working at a desk, finding herself with increasing lower back pain by the afternoon. Rather than resigning herself to discomfort, she could stand up, place a tennis ball between her lower back and the wall, and gently roll, finding that within minutes the aching eases, the muscles soften, and her posture improves. Later in the evening, she might do a series of cat-cow stretches on her hands and knees, breathing deeply as she arches and rounds her spine, feeling not only physical release, but also a sense of grounding and calm. These small but intentional actions accumulate, creating a daily rhythm of care that supports her throughout the remaining months, reminding her that relief is possible and that she has the tools to create it. Beyond the physical aspect, engaging in these practices often brings psychological benefits that are just as important. Pregnancy can be overwhelming, filled with anticipation, anxiety, and sometimes fear of the unknown. And when a woman takes time to focus on her breath, her movements, and the sensations in her body, she is in effect practicing mindfulness, anchoring herself in the present moment, and this has profound effects on stress reduction and emotional well-being. The tennis ball back massage, while simple, can become almost meditative, a time when she tunes out external distractions and pays attention only to the rhythm of her body, the pressure against the ball, and the gradual release of tension. In this way, a tool as ordinary as a tennis ball becomes a source of comfort, not only for the muscles but for the mind as well. The beauty of back pain relief exercises for pregnant women lies in their adaptability and accessibility. They do not require specialized gyms, heavy equipment, or hours of training. Rather, they invite women to use their own bodies, their breath, and simple everyday objects in creative ways to foster comfort and well-being. This approach aligns with the philosophy that pregnancy is not a time to push the body to extremes, but to nurture it, to work with it rather than against it, and to honor the extraordinary work it is doing. And when a woman feels supported in her body, she is better able to embrace the joys of pregnancy, to prepare for birth with confidence, and to welcome her child into the world from a place of strength and peace.